let's go into a few case studies to help illustrate some of the lessons discussed this week. Our first case study listed on the slide is about document destruction. Every healthcare facility needs to have a plan for the destruction of records when the retention period expires for records. The plan needs to include all records, to include medical, administrative, and financial. This case study covers indices, databases, and medical records. You have been given the responsibility of developing the documentation destruction plan for a healthcare facility. Your plan will meet the needs of customers while complying with state and federal law. You will use the criteria that are listed. 1. MPI data will be retained for 20 years. 2. Medical records will be retained for 5 years after the patient's last visit. 3. Registers and indices will be retained for 10 years. And 4. Paper records will be destroyed by fire. In order to critique this plan, each plan item will need to be reviewed. For the first one, is it correct that MPI data needs to be retained for 20 years? No, we have learned in the lesson that the MPI must be kept permanently and cannot be destroyed. That would need to be updated. For the second one, medical records will be retained for 5 years after the patient's last visit. The number of years the medical record should be retained is 5 years according to federal law. However, state laws vary as mentioned in the textbook. You will need to verify your state law does not have a longer retention period. State law will override the 5-year federal law retention period in this criteria. This can be found through the State's Hospital Association, reference area or website, or through an internet search. Number 3, registries and indices will be retained for 10 years. What do you think of this retention period? It is recommended that registries and indices be retained permanently, as with the MPI. This would also need to be updated. And the last one, on paper records being destroyed by fire. Do you think this is an acceptable destruction method? Incinerating records by fire is acceptable. However, you will need to specify who will perform the destruction. If records are being shipped to a vendor, there would be a problem transferring the records. It could become costly to package and ship hundreds of records for destruction. If the hospital is going to perform this function, it would help to specify the hospital incinerator will be used and that records will not need to be removed off-site. The most common method of destruction normally is shredding. There are shredding companies in major cities all over that will bring a truck on site equipped with a huge shredder. That allows for secure on-site destruction of records. The next case study puts you on the Quality Improvement Committee at a local hospital. The committee wants to review mortality data on its patients. Specifically, the committee wants to review all of the deaths at the hospital and the top 10 diagnoses of those patient deaths. As a member of the committee, you should have a few questions based on what the committee plans to study. What are some questions you might ask? A question might be, are we going to look at all deaths across the entire hospital, or deaths in certain areas, such as the emergency room or outpatient surgery. Another question may be, are we looking at hospital inpatients or hospital outpatients? Assuming this data will only be reviewed internally, you may want to know if primary or secondary information will be reported. It is important to know if patient identifying information will be reported. That will help to know how much detail will need to be collected. What would be your first steps in gathering this data? The data range would need to be determined, or date range. You need to know which year, the specific months of data the committee wants to review. It would also be helpful to know the purpose of the study. What is the ultimate goal of reviewing this data? A good place to start for this data is the Decision Support Area, Coding Department, or Health Information Management Department to help to run any necessary reports to identify the patients. Medical coders are very familiar with diagnosis codes and can help provide or interpret this type of information. You may also need to look at some outside resources that collect this type of information, such as the national quality agencies or databases. That would give the hospital a benchmark to compare themselves against. It would also help the hospital to get an idea of what causes of death are in their state or geographic area. As mentioned previously, the committee would need to determine what the purpose of the multi-study would be in order to properly analyze the data.